Hello everyone, I'm Dr. Nupur and we have with us Dr. Preeti here. And today we are going to discuss a very important topic, which is contraception during postpartum period or while you are breastfeeding and lactating your child. But at the same time, you need protection against unwanted pregnancy. So let us understand with Dr. Preeti that what are the options? Is it really needed? What can be done? And how can you protect yourself during this time period? So over to you, Dr. Preeti.
So, starting with it, we need to understand that breastfeeding is a kind of a natural contraceptive. When you are breastfeeding, there are certain hormones which are present in your body. They prevent ovulation, and that in turn prevents pregnancy. But this protection lasts only till are exclusively breastfeeding. So once you add a top feed, or there are certain gaps between your feeding, or there are, you get your period after your delivery, all these are indicators that you definitely need a contraceptive.
Okay. So now coming to the next point, is it really essential to use a contraceptive while breastfeeding?
Definitely, you need a contraceptive when you are breastfeeding. You've already delivered, so definitely you don't want to get pregnant again. So you need to keep an appropriate gap between your two pregnancies, and at the same time, you don't want any unintended pregnancy at this point of time. You don't want to undergo any kind of abortion or any other issues when you are breastfeeding. So yes, definitely you need a contraceptive while you're breastfeeding.
So your protection from 6 weeks to 6 months is only when you are exclusively breastfeeding. Otherwise, you need to use precaution because ovulation has returned back to normal, or maybe you have started your cycles and now the risk for pregnancy comes back again. Coming to the next point is, if we need to use a contraception, what is the best choice and how the decision should be made?
So there are a lot of options available for you when you are breastfeeding. The first is what we call as an intrauterine device, where a device is inserted inside the uterus. It is a very effective method of contraception, and it can be left for about for a duration of 3 years, 5 years, 7 years. This is one of the options we offer to a breastfeeding mother. The other option is an oral contraceptive pills. So there are largely two types of pills which are used as contraceptives. The combined pills, which are normally given to the patient, but for breastfeeding mothers, that is not the option because they can hamper the milk secretion, which we don't want. So the option available for breastfeeding mothers is a progesterone only pill, which are again a very effective method of contraception. Another option is injectable contraceptives. So, injectable contraceptives are again hormone injections which are used, and they give, so there is no need to take a pill every day. The patient, there is the protection is offered for about 3 months continuously. Another option which is available is the barrier method. It is the male and the female condoms. But the barrier method has a higher failure rate. So one needs to understand the risks of having pregnancy if, in spite of using the barrier method judiciously. Another important method of contraception are implants. These are hormonal implants, which are placed in the under the skin of breastfeeding mothers, and they release small amount of hormones in the body and give a contraceptive effect. So these are the options available for all breastfeeding mothers.
So thank you, Dr. Preeti, for highlighting various options. You can choose any of those. There are many choices that are available, but we need to customize as per your needs, and your doctor is the best person to decide which one you will need at this time and not have an unwanted pregnancy, and also enjoy the period of motherhood after delivery while you are lactating or while you are breastfeeding your child. So thank you so much for listening, and don't forget to like, subscribe, comment, and share with your friends and colleagues, whosoever is looking for a contraceptive option. Thank you.
Thank you so much, everyone.